Seizure, a comprehensive guide presentation.
What is seizure? A seizure is a sudden, uncontrolled electrical disturbance in the brain that can cause changes in behavior, movements, feelings, and consciousness. It occurs when there is abnormal electrical activity in the brain, leading to a temporary disruption in its normal functioning. Seizures can vary widely in their presentation and can affect individuals of all ages. How does seizure progress in the body? The pathophysiology of seizures involves complex interactions between neurons, neurotransmitters, and electrical signaling in the brain. It is divided into 3 phases. First, prodromal phase. This phase occurs before the seizure and is characterized by subtle changes or symptoms that precede the actual seizure. These may include mood changes, altered sensations, or behavioral abnormalities. However, not all individuals experience a prodromal phase. Second, ictal phase. This phase refers to the actual seizure activity. These may include convulsions, jerking movements, loss of consciousness, muscle rigidity, and altered behavior or cognition. Third, postictal phase. This phase involves the recovery and resolution of the seizure activity. It is characterized by confusion, fatigue, muscle soreness, headache, and memory difficulties. The duration of the postictal phase can vary, and individuals may experience different levels of recovery and cognitive function during this period. What are the risk factors of seizure? First, epilepsy. People with epilepsy have a higher risk of recurrent seizures. Second, previous seizures. If an individual has experienced seizures in the past, they are more likely to have future seizures. Third, brain injuries or infections. Traumatic brain injuries, strokes, brain tumors, or infections like meningitis can increase the risk of seizures. Fourth, genetic factors. Certain genetic conditions, such as Dravet syndrome or tuberous sclerosis, can predispose individuals to seizures. Fifth, developmental disorders. Conditions like autism spectrum disorder or neurodevelopmental disorders can be associated with an increased risk of seizures. Sixth, substance abuse. Illicit drug use or alcohol withdrawal can trigger seizures in susceptible individuals. Seventh, sleep deprivation. Lack of sleep or irregular sleep patterns can lower the seizure threshold and increase the likelihood of seizures. Last, medications and drug interactions. Some medications or drug interactions may increase the risk of seizures, especially if not taken as prescribed or combined with other substances. Signs and symptoms of seizure: convulsions, uncontrolled shaking or jerking movements of the body, loss of consciousness. The person may become unresponsive or unaware of their surroundings. Muscle stiffness or rigidity. Muscles may become stiff and difficult to move. Sensations. Unusual sensations or feelings such as tingling, numbness, or a sense of déjà vu. Controlled, altered behavior. Sudden changes in behavior, confusion, or staring spells. Changes in cognition. Difficulty speaking, understanding, or processing information. Loss of bladder or bowel control. Involuntary release of urine or feces. Emotional symptoms: some individuals may experience intense emotions, fear, or anxiety during or after a seizure. Nursing management of seizures. Observation and documentation. Nurses should closely observe and document the details of the seizure episode, including the onset, duration, type of movements, and any associated symptoms. This information helps in accurate diagnosis and determining the appropriate treatment. Seizure precautions. Implement safety measures to prevent injury during a seizure. Clear the surrounding area of objects that could cause harm, cushion the patient's head, and ensure there are no sharp edges or obstacles nearby. Maintain a safe environment, especially near stairs or water sources. Supportive care. Provide reassurance and emotional support to the patient and their family. Offer comfort measures, such as turning the patient to the side to prevent choking on saliva or vomit, loosening tight clothing, and ensuring a calm and quiet environment. Medication administration. Administer anti-epileptic medications as prescribed, ensuring adherence to the prescribed dosage and timing. Monitor for any side effects or adverse reactions and report them to the healthcare team. Education and counseling. Educate patients and their families about epilepsy, seizure triggers, medication compliance, lifestyle modifications, and safety precautions. Provide information on when to seek medical assistance and emergency care. Treatment of seizures. Anti-epileptic medications. Most seizures can be effectively managed with anti-epileptic medications. The choice of medication depends on the type of seizure and individual patient factors. The goal is to achieve seizure control while minimizing side effects. Vagus nerve stimulation, VNS. VNS is a surgical treatment option for individuals with epilepsy who do not respond well to medications. It involves implanting a device that stimulates the vagus nerve, which can help reduce the frequency and severity of seizures. Ketogenic diet. In some cases, a ketogenic diet, which is high in fats and low in carbohydrates, may be recommended for individuals with certain types of epilepsy that do not respond well to medications. This diet can help control seizures by altering the metabolism of the brain. Epilepsy surgery. Surgical interventions may be considered for individuals with severe epilepsy that cannot be adequately controlled with medications. The type of surgery depends on the underlying cause and location of the seizure focus. Interventions for seizure. Seizure first aid. During a seizure, ensure the person's safety by gently guiding them away from hazards and placing something soft under their head. Do not restrain the person or put anything in their mouth. Time the seizure and note any changes or unusual features. Post-seizure care. After a seizure, monitor the person's breathing and consciousness level. Help them reorient if they are confused. If the seizure lasts longer than usual or if there are complications, such as injury or difficulty breathing, seek immediate medical assistance. Emotional support. Offer emotional support to the person and their family, as seizures can be distressing. Encourage open communication, provide education, and refer them to support groups or counseling services, if needed. Prognosis. The prognosis for seizures varies depending on the underlying cause and individual factors. Many people with epilepsy can achieve seizure control with medications and lead a relatively normal life, and some individuals don't. Regular medical follow-up, adherence to prescribed medications, and lifestyle modifications can significantly improve the prognosis. This is Hara Maya Sambo. Thank you for listening.